In the last video, we talked about the first step you should take if you think you're having a real heart attack. In this video, I'm going to teach you what are the most common symptoms of a heart attack. So the most common symptom, the number one most common symptom of an individual having an active heart attack is chest pressure. Many of them will say that it feels like there's something squeezing in my chest. Some of them will say that it feels like there's an elephant standing on my chest. But I would say that most of the people will say it feels like there's something squeezing inside my chest, and it's deep. A deep squeezing sensation inside my chest is the most common symptom. The second most common symptom of a heart attack is trouble breathing. Everybody that I've seen in the last 20 years who's actively having a heart attack, we're talking like a serious heart attack, they always have some kind of trouble breathing. Either they say that I feel short of breath, or I feel like I can't catch my breath, or it feels like I can't take a deep breath. But every single one of them has said, I'm having some kind of problem breathing normally. I can't breathe normally. This chest pressure combined with whatever else is going on, I can't breathe normally. The third most common symptom is that the individual who says that they're having the chest pressure somehow says that the pain is also going into my left arm. So pain or pressure or an abnormal sensation in the left arm. Some people will say it feels like my left arm is falling asleep, or I can't feel my left arm, or there's like a heavy sensation in my left arm. But the third most common symptom that I've seen is some kind of a symptom related to weakness or heaviness in the left arm. The fourth most common symptom that I see is some kind of numbness or tingling or pain that radiates from the chest region up into the left jaw. Most people who report this will say that it feels like my left jaw is numb, or it feels like I can't open it the way I normally should, but I can. I'm able to talk. My speech isn't slurred, but it just feels like there's pain that's also in my left neck and in my left jaw. So there you have it. Those are the most common symptoms of heart attack that I've seen as a physician actively working in the emergency room on a regular basis over the last 20 years. Now that you've learned the most common symptoms of a heart attack, what do you do with this information? Well, the first thing you need to do is consult with your regular doctor. You'll notice that in my videos, I have a tendency to always ask you, the viewer, to talk with your regular doctor first before you start trying to make clinical decisions. And there's a reason for that. The reason for that is, unless you really are a doctor, you're not a doctor. And so I don't want you to make any mistakes that could cost you. I want you to be safe.